this segment, we're going to be talking about how to set up for a bed bath. Always think infection control, especially when you're giving a bed bath. All right, so what we're going to do is we're going to show you, if you have a table, sometimes they'll have a bedside table, and what we want to do is set up a barrier on the table for your supplies. You're going to need 2 basins. You're going to need plenty of washcloths, and I'll talk about that in a second. You're going to need a couple sets of gloves. You will also need a new chuck for after you're done, and a new Depends, a brief. You will also need your soap, nice way to cleanse, and then a barrier if the doctor has ordered your barrier for the resident. Now, some people might not know that there are bathing cloths. And literally you can bathe somebody, and this does have some type of moisturizer in it, so you would not need the basins or the water. It's rinse-free, no water necessary. So this sometimes is a nice way to give a quick bed bath, but it's a partial bed bath on this. When you do a partial bed bath, you're doing more of the upper body, and then of course you're going to do peri area. So that's another option. Now, we also have what we call a shampoo cap. Now, this is really nice if we don't have a way to really immerse her hair, and sometimes they'll have these rubber tubs that you can use for your resident. But this is another alternative. And then you would place this on her hair, kind of work it in for a few minutes. I'll show you how to do that. You would basically massage it for 2 to 3 minutes, let it sit, and then when you take it off, you then can comb the hair, and this absorbs it, the dirt. Okay, so let's talk about water. We have 2 tubs, and you'll see many a times that people have taken all the washcloths and then take a washcloth, soak it, and then they dispose of it, and then they rinse in the dirty water. That's not what we're going to do. This is going to be clean, water only, and then when we're done cleaning that portion, we're going to dispose of this. This is why you're going to need about 10 different washcloths, okay? Now, you'll see that I have set these washcloths out flat. It's a little bit easier to get instead of having just piles of this, because you're not going to be worrying about rinsing. So, make sure that you have your gloves. You're going to don them before you actually touch your resident. We talked about this earlier, that we want to make sure that our gloves fit just right. We don't want them too loose. Make sure you wash your hands before you put your gloves on. Now, let's look at how the best way to create a mitt. So, what we're going to do is we're going to take your washcloth, you're going to fold it here, and you're going to fold it here. You're basically going to make a nice little mitt from this. Now, even though I am right-handed, I can put it on here, and then I can help her with my dominant hand if I have to move her. If you're more comfortable using your dominant hand, go ahead and do that. Okay, now this is already wet, and it shouldn't be so moist that it drips. So when you take it out of here, and it's laying flat so it's a little bit easier, if it's too wet, go ahead and wring it. So let's set that up again. Here, here, and here is a mitt. Now, when we start to clean somebody's face, we always start with the eyes. Again, put your towel over here. We're going to go to the farthest eye, and we're going to have her shut her eyes and go ahead and start in the corner. And you can wait just a second, very gently take it out here. You can move this around a little bit, and go on the next eye. Again, her eyes are closed, and we start in the corner, gently moving out. Okay? What we can do also is move the towel down a little bit and go ahead and start with her forehead. Now, a lot of people don't like soap on their face, but they will just have some nice water to go ahead and clean this area. Again, cleaning, gently cleaning this area. And don't forget the ears and cleaning the inner ear here. On both sides, gently cleaning the ear. Okay? And you can take this and go ahead and now get her neck. Again, getting her neck. And notice it doesn't matter that I'm touching this area because it is protected with the barrier. Okay, now that I've done that, I'm going to dispose of that particular cloth. I come back in and I'm going to gently, just nice and gently, take this and pat dry. I don't want to have any moisture on her face. Okay, now let's talk about cleaning the rest of the body. What we start with is the upper body. And she is totally covered on that side. We're only going to expose the parts that we're actually going to clean. So, we want to start with this. So we bend this over here and we're going to start on the arm and then we're going to go to the side. Again, taking your washcloth and making sure if it's too runny, make sure you wring it out. Otherwise, you can take it out and you can create your mitt. All right, this is where you would want to put your soap on it. Okay, so we have a little bit of cleanser, and then what we would do is put the cleanser on it. And now we're going to start at the hands. So we start on the hands, cleaning gently all the fingers and in between the fingers. We're going to do a nice circular motion. For one, that promotes circulation in the arms. So again, we're going to clean here, up and down, and we're not going to clean the armpits yet. We're basically going to do this area, again, preserving dignity, coming here, coming on the side, and now what we can do is we can lift this up without exposing everything, but again, coming here on the upper body, okay? We can change this, and that soap's still on that glove. And again, what we're going to do here is come here. Now you might have to lift up a breast to make sure that you're getting underneath the breast. This is a good time to check for any problems, any redness. Again, preserving dignity and cleaning this area. Now, since we're really done with this part, what we can do is now we're going to do the armpits. So we can help raise that person's arm. Use a little gentle stroke right here in the armpits. Now, again, we're not going to rinse this. We're going to get a new towel. And we're going to start at the hands. This is nice clean water, and we're going to take all this soap off. Again, all the arm area, nice and clean. Getting that soap off. Change the mitt. Again, exposing only what's necessary. Go ahead and do this area. The chest here. And again, underneath the breast, here. And then finally, we can get the armpits. Oh. All right, now, again, dispose of it. Take your towel, and we want to dry this area. Nice and simple. Dry it. Dry this area. And definitely make sure that you are drying underneath the breast area. So you want to bring it up and wipe. Again on this side, we want to moisten. Take that moisture out. Again here, and again to cover up. Go ahead and cover her up again. Now I'm going to show you how to clean the leg area. Again, get your cloth, rinse it out if you need to a little bit, set it up, and again, just a little bit of soap will go a long way. Now, just expose the area that you need to clean and no more. Now this area, the peri area, we're going to be doing in another video. Now, we always start at the feet and work this way. We don't go from here down. So starting at the feet, what we want to do is we want to start at the bottom of the feet. And a lot of people like a little foot massage while you're doing it. Make sure that you're cleaning in between the toes and you're drying in between the toes. So again, get this. Look at the heels of the foot. Here you go. And again, a nice circular motion. Can have somebody, good circulation. And again, coming up slowly. You can turn it around, holding it, coming here on this side, coming here, and again, making sure you're getting all of this area cleaned. Okay, now we're going to rinse this area. Again, squeeze. Starting at the foot. And again, you're going in between each toe, making sure that we're getting all that soap off. Because what we don't want are feet that are going to start cracking. If you don't get all the soap off, it's going to dry out even quicker. Again, looking, cleaning, again, cleaning, rinsing this area. Okay, now we're going to pat dry. So you can see this is much easier when it's a small towel. You can get the whole leg. When you're drying the foot, again, separate the toes and go ahead and make sure you get in between each toe gently. When you're done, cover that area. Now we have to clean her abdomen area. So we still want to preserve dignity. We don't want to just pull this all the way down and just uncover everything. So it's okay to use another small hand towel and go ahead and keep her covered in this area, exposing just what we have to clean. Again, squeeze it out. Use a little bit of soap. Now, if they have a wafer and a colostomy bag, it would be okay to change this at this point. But if they don't, then we're not worrying about it. So let's go ahead and clean this area. Going on the sides, cleaning this area. Nice circulation. Coming here, coming this area. all of this area. If they do have a stoma from this, and this wafer is off, it's taken off, and you have the stoma, you can clean the stoma, but very gently. Sometimes, even though a stoma has no sensitivity, you still don't want to rub it too hard, and you want to check for coloring. So again, you're wiping this area. You've already cleaned this area. So we get our new cloth, rinse it out, come over here, and now we're rinsing all of this area. I told you you'd need a lot of washcloths to do this. Once it's done, you'll take the small towel again, and then you're just going to make sure it's nice and dry. Again, preserving dignity as quickly as possible, bringing the other one away, and you can use it for another area. Now you've done the other side, just like the first side, and now we're going to do the back. So again, we're going to roll our client over and make sure that we're using our full hand, not pressing on the hip, but rolling her gently to the side, keeping this, preserving dignity. Now, we have to clean the back and the buttocks area. And again, I've moved our basin over here to make it a little bit easier. And we're going to again put our mitt on. A little bit of the soap. And now I'm just going to go to this part here in the back. We're going to go ahead and wash this area. Again, a nice circular motion. Okay. And since we didn't get the neck, we're going to get the neck in this area. Okay? So go ahead and get the neck. Again, wiping, and then we discard this. Then we take our clean one and go ahead and clean this area. Just rinse it, getting all that soap off. Again, checking at all times the skin, making sure that we look for any redness, any dry skin, anything. Okay, now we're going to dry this area. Gently patting here in this area. Okay. Now, when it comes to the buttocks area, you only want to expose what you have to. Now, remembering at all times that you go wiping from the front to the back. You probably will have to lift up the cheek, and that's not a problem. Making sure you put your soap, and we start here, and we come from the front to the back. Moving front to the back, getting all of this. Okay, here, turning it again, and again, you might have to lift this up, but gently go through this area. Again, front to back. Making sure you get everything nice and clean. Then we're going to go ahead and rinse this area, starting from the front to the back. Front to the back, front to the back. Now, we also want to dry the same way. Having dry, and again, lift up the butt cheek if necessary to get inside. And again. Okay, and then getting her covered as soon as possible.
Pericare involves cleaning the genital and anal areas. These dark, warm, moist areas are ideal for the growth of microbes. Regular pericare prevents infections, odors, and promotes comfort. Allow supported persons to do their own peri-care if possible. Some may need assistance and supervision with this. Be sure to use language that the person understands, as not all people will know what a perineum is. Most individuals understand what private parts are. Keep the terms tasteful and professional. Follow standard procedures or universal precautions, and wear gloves while doing peri-care. Work from the cleanest area to the least clean area. The urethral area is the cleanest, and the anal area is the dirtiest. You do not want to cause a urinary tract infection by transferring microbes from the anal area to the urethra. When providing female peri-care to an individual who needs total assistance, use peri-wash or the person's preferred skincare product. Inform the person what you're about to do. Expose the perineal area only. Have her open her legs and flex them if she is able. Tuck a towel under her buttocks. Separate the labia and wash downward from front to back in one stroke, as many times as necessary to clean the area. Be gentle, as mucous membranes are delicate and easily injured. Use a separate part of the cloth for each stroke. Never wash up in the direction from the anus to the front of the body. If the woman is menstruating, you may need several cloths to wash the perineum and change the water before moving on to the anal area. Rinse and pat the area dry with a towel. Repeat for the groin area, suprapubic area, and inner thighs, being sure not to take any microbes back to the urethral area. Assess the peri area for redness, odors, discharge, swelling, or irritation. During all bathing care, you will be assessing the person's body for the following: color of skin, dry skin, skin temperature, swelling of feet or hands, location and description of rashes, bruising or open areas, redness, particularly over bony prominences, drainage or bleeding from wounds or body openings, complaints of pain or discomfort. When providing peri-care to males who need total assistance, first have him lie on his back. Expose the perineal area only. Have him open and flex his legs if he is able. Tuck a towel under his buttocks. If the male is uncircumcised, you will need to grasp the penis and retract the foreskin. Wash the tip of the penis in a circular motion, starting at the urethral opening and working outwards. Repeat as many times as is necessary, using a different part of the cloth. Rinse the area well, and return the foreskin to its natural position. Clean the shaft of the penis with downward strokes, going from the head of the penis towards the body. Clean and rinse the scrotum well. Observe the area for redness, irritation, especially in the skin folds. Wash, rinse the suprapubic, groin, and inner thigh areas well. Dry the entire area.
So now we've got Ms. Molly back in her position, and now we can remove our gloves. Again, remember what I said about gloves? They can get a little sweaty, they can get a little hot. You can take them off here from the center, going down, gathering it up in your hand, and removing the gloves. Remember, when you're giving a bed bath, it's awkward for your resident. Always make sure you're getting the best privacy. You're going to actually ask questions to find out what their capabilities are. You want to find out if they are in pain, do they need a pain medications, about safety. If there's no bed rail, maybe it's time to have another caregiver to hold, make sure she's not going to fall over, reposition her in the bed where if she rolls a little bit too far, she's not falling out of the bed. Again, preserve dignity and make sure they're comfortable at all times.